People are really afraid. We're really fighting two wars. One is against the virus and the other is the fear among the public. Since the human-to-human transmission is limited, should people be afraid? Should we be on high alert?
I think the preparedness and high alert or afraidness, that's the different levels. So since we already have some third generation in South Korea, so of course, people must be prepared. We must be prepared for this any possible, sort of expansion of this outbreak. So obviously, from what we know now, I think we don't need to be panic or we don't need to be afraid, but we must get prepared.
Explain to our global viewers here, at what stage, at which generation should we be spooked?
Okay. So when we are talking about the third generation, generally speaking, for 4 years now, starting from 2012, all the patients, when we have the first patient, as Bernard mentioned, we call it index patient. That's the first generation. So usually from that patient transmitted to another patient, we call it the second generation. If that second generation transmits to another one, so that we call the third generation. Looks like the transmission chain at the moment will stop the most at the third generation. So that's really lucky enough, like Bernard already mentioned to you. So this virus, the transmission is limited and not like the SARS, they can transmit it through the air. Maybe this virus needs close contact, including maybe droplet. Droplet is not air. From some droplet from your respiratory system, so that's really totally different from whatever we saw, like the flu or seasonal flu is transmitted from air.
I would like now to turn to our Singapore guest, Mr. Guibert. You've been advising a lot of enterprises and hosted a lot of webinars about MERS. What are the general public thinking about the virus so far? What are their sentiments? Are they afraid?
They are not afraid. However, they consider it is their responsibility to take care of their employees, particularly for those who are being sent for business reasons to these countries, and particularly Korea today. So what they are doing, they are informing their travelers, they are making sure their information is at par with what international organizations say and what the media report as well. They are also educating their travelers with, as mentioned before, basic health education such as washing hands or keeping away from people who are sick. And also what they are doing is they are tracking and monitoring where their employees are being sent to and where are they coming back from, so that if there's a case at the company, they can monitor and support contact tracing with public health authorities.
Although fairly recent, MERS is not new and South Korea is not the only country affected. From 2 cases in the United States to over 900 in Saudi Arabia alone, marked dark blue on the map. Otherwise, occurrences have been sparse until South Korea this year, where it infected more than 100 people since 2012. It has infected over 1,200 people across 25 countries and killed nearly 450 people to date, according to the WHO. So cases have been few and far between the time space of 2012 to now. So why South Korea is suffering the most here, apart from Saudi Arabia, of course?
Well, we don't have all the answers. I mean, as we have discussed already, it's a fairly new virus. It's a fairly new disease. There's many things that we don't know. We do think we have, some sources for the infection, but we still don't know exactly when it comes to infection chain from an animal to a person, from a person to another person. Now, what we do know, though, and that's very clear, the most important is to identify those who carry the virus very quickly as possible, bring them into the right clinics, keep them in isolation, not only to make sure that they are safe for their own health, but also to make sure that virus doesn't get transmitted to other people. These measures put in place very effectively can effectively stop an outbreak.
You've been talking with South Korean governments to help curb the situation. What's your take on their performance?
Well, there's 2 things. One, with the death rates that you're mentioning, I think it's too early to have a final judgment. And people still sick, they're still in the hospital, we have to observe. But on the other hand, we do know that if people get into the hospitals with good equipment, they can be kept alive. And if the longer we can keep them alive, the higher is the chance that they actually fully recover. Now, the point in Korea was that it did take some time to take the right diagnosis, and that's simply because people didn't think about it. Seeing a patient with very general, symptoms like a general flu, that didn't think about, MERS immediately, and that was the time that the virus took to actually then be transmitted to others. Now, once a diagnosis was made, I think action was taken fairly quickly and fairly decisively. The Korean government has invited the World Health Organization to establish a joint mission, which is currently on the ground in Korea, as we have seen earlier in this session, and we are discussing, with Korean experts and international experts, what has happened there. We are going to clinics, we are looking into laboratories to find the best information, to see how we can improve the measures taken right now in Korea to curb this epidemic, to bring this to an end, but also to learn how we can actually prevent future outbreaks in other places.
And Mr. Guibert, what do you think of South Korean government's response to the MERS virus?
I think the response is appropriate, and particularly when it comes to educating people and making sure that they don't put themselves at risk by contaminating themselves while visiting hospitals, is definitely the right education measure. And when it comes to informing companies and private businesses, I think the right messages have been conveyed so that private businesses can definitely participate to this public health effort.
I recall in the years of the SARS, I was in Guangzhou during that year, and I only got the information from the government about a month or two after I got text messages and rumors around my friends and teachers about the virus. So the Chinese government have been doing fairly well in this MERS outbreak. They quarantined all those who had close contact with the patient zero. What's your assessment on the Chinese government's performance on this?
I think so far we are doing very well. As you know, those close contact day is the last day for the incubation period. So we know those close contact under isolation, and now they can be released. So the government immediately, we learned a lesson. We got some experience from what we have done during the SARS outbreak, back to more than 10 years ago. So we know the nature of the MERS virus looks like very similar to the SARS virus. We know the early intervene, especially try to isolate those close contact. This strategy works very well. So this is why, from the very beginning, we try to trace back to get this suspected patient traveled from Korea, and then we isolated all those close contact, more than 70 people. So looks like the measure works very well.